Hi, my name is Steve Fadem, and I'm a kidney specialist here in Houston, Texas. And I am also the chairman of the Medical Advisory Board for the American Association of Kidney Patients. Well, I met with three wonderful people. They were all representatives for either a congressperson or a senator. The first was a congresswoman, and we discussed a lot of health issues. And next I met with Senator John Cornyn's representative. Why is it that the medical profession does not focus on nutrition? Why do you focus mainly on the end stages of a disease and you don't necessarily focus on the wellness aspect of it? And I told her that's music to my ears, because what we really want to do is focus on preventative nephrology. And I explained to her that there were several blockbuster drugs that were now available that we could use to stall the development of end-stage kidney disease. And these drugs were making a real difference in how we cared for patients. And I also said that getting people to eat right makes a tremendous difference. The foods we eat can really impact our health. And nobody understands what kind of diet they should be on. And when you pay a dietitian, they get paid with petty cash. And so there's really not enough money in funding to support a dietitian. And this became a very important topic. It was very easy to share my opinion and also our team's opinion. The people that we worked with were very engaged. They were very, very well informed, and they seemed to be totally consumed by what we were saying, because we were talking about health. We were talking about health that would, and what we said appealed to them because they had parents and they had grandparents our age, and so they identified with what we were saying, and they were very engaged and they listened very carefully. I think that when elected leaders hear from kidney patients, it brings them one step closer to the problem. And it also makes them realize that they too are not immune from kidney disease, that it's not something which is unique. We emphasize that 1 in 3 people in the country have some sort of kidney problem, because hypertension is a kidney problem. And when we emphasize, number one, how common it is and how we are people that have abnormal kidney function, and I have abnormal kidney function, and it's age related, and it's something which I'm aware of, and I have to plan my life accordingly. And when I share that with an elected official, number one, they want to hear it because it pertains to them as human beings. They may want to share the same things I'm talking about with their own lives, particularly if they're closer to my age. And also they may have relatives with kidney disease. So I think the patients expressing their stories is one of the most valuable ways that information can be transferred. And that's where you can really get the elected officials to listen.